Support for Radio Friends comes from Columbia Healthy Smiles, the dental office of husband and wife team Dr. Batson and Dr. Abe, offering comprehensive and customized care to patients of all ages. Learn more by calling 573-721-9039 or online at www.columbiahealthysmiles.com. Good morning and welcome to Radio Friends on this Wednesday, December the 28th. We're going to talk today a little bit about the correlation between chronic kidney disease and mental health. I didn't realize that the two could be tied in together. And I want to introduce you to Dr. Smrita Dorairajan from the VA hospital. Welcome, doctor.
Hi, Paul.
You were telling me when you came in today that there is a correlation between chronic kidney disease and mental health. How does that work?
So chronic kidney disease patients have a lot of mental health issues.
Why?
So firstly, it's like a chronic problem they're dealing with. And most of them have to deal with it lifelong. And sometimes there's poor understanding of the disease and what it holds. So there's a lot of anxiety associated with this diagnosis.
Okay, what is chronic kidney disease?
So chronic kidney disease is wherein mainly it's from diabetes, hypertension. These are like two of the commonest reasons, sometimes using analgesics like NSAIDs for very long periods of time. They can cause damage to the filtering units in your kidney. And so if a normal kidney is supposed to function at about 90 to 100%, this kidney just functions suboptimal. So it doesn't filter or perform all the functions of a normal kidney.
How do you know if you have a kidney disease?
So it is based on a blood test. So it is a muscle protein excreted by the kidney that we measure. And depending on what value it shows, they're able to calculate based on a formula what your kidney function is.
Can you have a chronic kidney disease and not be aware of it?
So nearly half the patients with chronic kidney disease don't know that they have it. So whenever they're referred to me as a nephrologist, a lot of patients say this is the first time I'm hearing that I have it.
Now, when you go in for your yearly medical exam and they take a blood test, and they do a blood test for, it seems like everything in the world.
Sure.
Are you being checked for your kidneys also in that blood test?
Yes. Most primary care doctors check for this now because screening is a big thing now for chronic kidney disease, especially if you're a diabetic or a hypertensive. The routine blood test that you get can pick up this problem.
Okay, so when I went in, I had my yearly physical, and they took a blood test. When he said everything's fine, that means that they did screen for my kidneys at that time.
Yes, very likely, yes. Because this is the commonest blood test. After a blood count, this is called a basic metabolic panel, and everybody gets this.
It's called a what?
Basic metabolic panel. So basically, it gives you your sodium level, your potassium level, and then your kidney function and all these things.
So that's the only way that you really can tell if you have kidney disease, through that blood test.
Yes.
If it goes on, let's say you haven't had the blood test, you haven't gone to the doctor for a long time, and you have a kidney disease, you don't realize that you do, what's going to be the first sign that you will notice that your kidneys aren't functioning properly?
So sometimes when you have like kidney disease, it can lead to high blood pressure. Sometimes you spill protein in the urine, and this can manifest like a foamy or a frothy urine. But most of the time, as I said, it's a very silent, smoldering disease. And unless you get this blood test, you wouldn't know. So there are not like many symptoms associated like heart trouble, where you develop shortness of breath, chest pain. And
so you could die of kidney disease and not even know that you have it?
So it is, like I said, a smoldering. So it's not going to kill instantaneously like a heart problem. So it is a chronic problem. It's like slowly progressive.
How do you treat it?
So basically, you treat the underlying cause. So if your hypertension is causing it, controlling your high blood pressure. If your diabetes is the one causing it, keeping your blood sugars under very good control. If you are abusing pain medications or analgesics for a very long time, and that is the causative agent, then quitting those.
What do you call abusing pain medication for a long time?
So non-steroidal anti-inflammatory drugs.
Is that now that
Ibuprofen, Motrin, Advil, Aleve, Naproxen, all of these belong to this group of medications.
Does aspirin?
Aspirin does, but baby aspirin or 325 milligram aspirin a day that you take for your heart, it doesn't cause this problem.
But if you take 500 milligrams or 1,000 of aspirin
on a daily basis,
for a long period of time.
So these medications were approved only for use for a week to 10 days or so. But unfortunately, not many patients know about it, and they just take it indefinitely. Sometimes it may be for like after a tooth extraction, they're given it for a week, or like for minor aches and pains, they're prescribed for a week. And then they like the effect that their pain is gone, and then they just start buying it over the counter and using it on a daily basis without knowing the harmful effects.
How long?
A lot of patients know that gastritis is a common side effect, but they don't know that kidney trouble also is a big side effect of these group of medications.
How long could you be taking this medication before it causes a problem?
So it's usually for it depends on each person, but it's usually for at least 2+ weeks.
Really?
Yes.
After 2 weeks or so, you could start causing a problem?
Yes, some people have trouble, even with 2-3 weeks of taking non-steroid.
So somebody that's been on it for a year or more.
Yeah.
What about Tylenol?
Tylenol is mainly excreted through the liver. So Tylenol is still fine to take. So for our kidney patients, we actually tell them to take over-the-counter Tylenol.
Can you be on Tylenol for a long time and not cause damage?
Unless you have liver trouble and you don't exceed too much, then you can take Tylenol.
Well, there's so many things for us to think about.
I know.
But the important thing is get that yearly blood test.
Yes.
It will. You're being screened for it when you get your yearly physical.
Yes.
Okay.
And if not, talk to your primary care asking whether you can get your renal function test.
Okay. Doctor, thank you so much for coming by. You're always so interesting, and you have good information for us. I appreciate it. Dr. Smrita Dorairajan, correct?
Yes,
all right.
You got it, absolutely. And happy holidays
Same to you
and all the viewers.
All right, and I hope you have a very safe and prosperous 2023.
You too.
All right.
Thank you.
Something you'd like to hear or see, I'd love to hear from you. Drop me an email, pepperp@missouri.edu. Bye-bye.